So how can decompression help with all these issues we've been talking about the last few weeks? And the degeneration, the sciatic, the neuropathy, knee pain, foot pain, low back pain, just chronic stiffness, poor posture. Well, decompression does a few things, but there's a nerve that comes out between the two vertebrae. And when you're doing decompression, you're literally decompressing or stretching apart that disc space, that bone place from the disc, to allow the disc to be reabsorbed back in. And the higher that disc is, the more room for the nerve to come out. So if the nerve opening starts to get tighter and tighter, this is called stenosis. They'll get stenosis on the spinal cord or nerve root, entrapment. And the narrower that gets, the less room for that nerve to come out, chronic pain, chronic problems. Well, once you get to a chronic state like this, there's virtually no room for that nerve to come out. So it's always in a state of compression. We talked about the rock on a garden hose. It would be like a permanent rock embedded on the garden hose. You can never get it off. You may be able to open it up a little bit, but you'll never heal completely in this state. So two things: when you catch it early, it's imperative to do everything you can to get that disc open up, to get that nerve opened up, so there's no entrapment and you get total healing. And when you have degeneration, it's super important to do everything you can to stop it from getting worse. This will not look like this ever again. And this we've seen this at age 50 and up. So the sooner you get to it and the sooner you stop it, the more hope you have for healing. And the body is absolutely incredible to heal. God made a body that is self-healing, self-restoring. But we have to do our part. Healing comes through these nerves. And if the more nerve entrapment, the less healing. The more we can stop that, open that up, the more healing is restored. And these nerves, they go everywhere. Not only do they go into your legs and down your knees and down into your feet, but we do decompression in the neck, where these neck nerves go into the head for headaches, sinuses, the eyes, ears, nose, and throat, into the lungs, into the heart, into the thyroid. So many of these issues are occurring as we age, and we think we're just aging or we're developing a problem. It may be that you have compression on your disc, that you have to open these up. So when you open them up and you realign them, you do two things. One, you stop it from getting worse. Always does that. Two, you start to allow healing to be restored. And as healing is restored and you maintain that, that can last a lifetime if you learn how to do it. So that's what it can help with. And I hope you got benefit from these videos. Decompression therapy and the things we do in our office just is amazing in helping people not only get out of pain and start to get movement restored, but allow that joint space and that disc to heal to a higher level, to then stop it from ever aging again, and you can maintain that health of an organ, of a tissue, of a muscle for the rest of your life. So I hope that helps.